In this video, we will explain why onions, despite their reputation as a superfood, can be harmful for people over the age of 60. You will learn which health conditions make onion consumption inadvisable and why ignoring these warnings can seriously damage your health, especially at an older age when the body becomes more vulnerable. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Do not eat onions after the age of 60 if you have cardiovascular diseases or problems with blood clotting. At first glance, onions seem like a real health treasure. They help lower blood pressure, widen blood vessels, and make the blood flow more easily. But everything changes when it comes to people over 60 who have chronic heart conditions or a history of heart attack or stroke. Raw onions contain a large amount of biologically active compounds, including quercetin and sulfur-containing substances that can increase blood flow and lower blood pressure. This may benefit a younger body. However, for older individuals with impaired cerebral circulation, ischemic heart disease, or those taking blood-thinning medications on a regular basis, this becomes a risk. According to data from the National Institute on Aging, people over 60 with ischemic heart disease who consume foods that enhance blood flow experience episodes of dizziness, blood pressure dropping below 90 millimeters of mercury, and impaired cerebral circulation 3.2 times more often. In addition, according to the American College of Cardiology, when anticoagulants are taken together with foods that contain natural antiplatelet agents like onions, the risk of gastrointestinal bleeding increases, even in the absence of ulcers. Raw onions are particularly dangerous in this case, since heat treatment destroys some of the active compounds. But in salads, pickles, and homemade appetizers, onions retain their full potency and can unpredictably affect the vascular system. That is why, if you are taking blood-thinning medications, have recently experienced a cardiovascular event, or suffer from low blood pressure, you should be especially careful with onions. You do not have to completely give them up, but it is better to consult your doctor about consuming them and avoid raw forms. Do not eat onions after the age of 60 if you have chronic lung diseases such as chronic obstructive pulmonary disease or frequent bronchitis. If, after turning 60, you notice that shortness of breath has become a regular issue, your cough lasts longer than usual, and every cold season ends with bronchitis, then you should pay special attention to foods that irritate the respiratory tract. Surprisingly, onions are one of those foods. Raw onions contain essential oils and volatile sulfur compounds that easily reach the upper respiratory tract and trigger a response: mucus production, sneezing, throat irritation, and coughing. In healthy people, this may only result in tearing while chopping onions. But in older adults with chronic obstructive pulmonary disease or bronchial hyperreactivity, the reaction can be much more serious. A 2022 study by the American Thoracic Society showed that patients over the age of 60 with chronic obstructive lung disease who consumed foods with strong irritating effects, including onions, garlic, and hot peppers, experienced bronchospasm episodes 27% more frequently over a 3-month period compared to the control group. Additionally, the participants more often required bronchodilators and maintenance therapy. For people with chronic bronchitis, even minor irritation of the mucous membranes can lead to increased inflammation and trigger flare-ups. This is especially relevant in winter or during seasonal transitions when the respiratory system is already weakened. If you notice that eating raw onions increases your coughing, causes throat irritation, or makes breathing more difficult, do not ignore these warning signs. It is better to temporarily remove onions from your diet or use them only in thoroughly cooked form, for example, stewed, where the irritating compounds are almost completely neutralized at temperatures above 85 degrees Celsius, which corresponds to approximately 185 degrees Fahrenheit. Do not eat onions after the age of 60 if you have tumors in the digestive organs or are undergoing intensive chemotherapy. Many people consider onions to be universally beneficial, and it is true that they contain flavonoids, vitamins, sulfur compounds, and antioxidants. However, in the presence of serious digestive issues, especially in individuals over 60, onions can have the opposite effect. Instead of promoting recovery, they may cause irritation. If a person has been diagnosed with malignant growths in the stomach, intestines, pancreas, or liver, The mucous lining of the digestive tract is already in a highly vulnerable state. In this condition, any additional irritation, especially from foods with strong, pungent, spicy, or sour flavors, can intensify inflammation and trigger unpleasant symptoms such as cramps, pain, nausea, and even aversion to food. According to a 2023 clinical review by Memorial Sloan Kettering Cancer Center, patients with tumors in the digestive system who consumed foods containing essential oils and sulfur-based compounds, such as garlic and onions, experienced a 31% increase in dyspeptic symptoms. These foods also reduce the tolerability of chemotherapy, particularly during the early weeks of treatment. For people undergoing treatment with cytostatic or targeted drugs, the stomach and intestinal mucosa are especially sensitive. In this situation, even a small amount of raw onion can cause a burning sensation, intensify nausea, and even lead to temporary refusal to eat. This is highly undesirable since maintaining nutrition and avoiding sudden weight loss is crucial during cancer treatment. In addition, the liver in such patients often operates under stress. It works to cleanse the blood of tumor waste products and medications. Onions stimulate metabolic activity in the liver, adding further strain to an already weakened organ. That is why, if you are undergoing chemotherapy or have been diagnosed with a tumor in the digestive system, cancer specialists in the United States recommend temporarily avoiding onions, especially in raw or fried form. Onions can be reintroduced into your diet only after consulting with your oncologist and if you are feeling well. Do not eat onions after the age of 60 if you have type 2 diabetes, obesity, or metabolic syndrome. After 60, metabolism slows down, physical activity tends to decrease, and the body's sensitivity to sugar and insulin changes. Many older adults face diagnoses such as type 2 diabetes, prediabetes, metabolic syndrome, or obesity. In such cases, despite the popular belief that onions are beneficial, this vegetable can play an ambiguous role. Raw onions do contain compounds that may help lower blood sugar levels. However, in people with unstable diabetes or reduced insulin sensitivity, this can lead to the opposite effect, a spike in glucose levels or hypoglycemia. This is especially true when large amounts of onions are eaten on an empty stomach or combined with other foods that stimulate the pancreas. A 2022 study by the Joslin Diabetes Center at Harvard Medical School found that in patients with metabolic syndrome, consuming dishes containing more than 150 grams of onions per day caused significant fluctuations in blood glucose levels. In 38% of participants, hypoglycemia occurred within 1 to 2 hours after eating, accompanied by weakness, shaking, irritability, and then a rebound spike in blood sugar. Caramelized or fried onions are especially risky in this regard. First, when onions are cooked with added fats and sugars, they become a food with a high glycemic load. Second, such dishes tend to stimulate appetite and often lead to overeating, which is highly undesirable for people with metabolic syndrome. Additionally, according to the Obesity Society, in older adults with excess body weight, the appetite stimulation caused by onions in fried or spicy dishes can lead to dietary lapses and make it more difficult to control food intake. If you are managing your blood sugar, watching your weight, or taking medication for diabetes, you need to be very cautious when adding onions to your diet. It is best to avoid fried or sweet forms and limit your intake to a small amount of stewed or boiled onion, only after consulting with your doctor or a registered dietitian. Do not eat onions after the age of 60 if you have dementia, along with unstable blood pressure or blood sugar levels. When a person is dealing with cognitive impairments such as dementia, especially later in life, the body becomes particularly sensitive to internal fluctuations. Even seemingly minor changes, like shifts in blood sugar or blood pressure, can significantly affect well-being. These two indicators, glucose level and blood pressure, can both be influenced by certain foods. Onions are one of them. Raw onions contain compounds that can lower blood sugar by stimulating the activity of the pancreas. While this might be beneficial for a healthy person, for older individuals with dementia and unstable diabetes, these changes can lead to episodes of hypoglycemia. This condition can bring on weakness, vision darkening, and confusion. In people with cognitive impairments, it may cause severe disorientation and even panic-like behavior. Onions also affect vascular tone by dilating blood vessels and lowering blood pressure. This may result in dizziness, sudden fatigue, and falls, especially if the person is already taking medication to reduce blood pressure or suffers from hypotension. According to a 2023 study by the Johns Hopkins University School of Medicine, in elderly individuals with both dementia and type 2 diabetes, daily blood sugar fluctuations were directly linked to worsening memory, disorientation, and increased anxiety symptoms. Consuming foods that caused spikes in glucose or blood pressure intensified dementia symptoms by an average of 23% compared to those who followed a stabilized diet. Therefore, if you or a loved one has been diagnosed with memory or cognitive disorders and is also dealing with unstable blood sugar or pressure, onion consumption should be approached with caution. This is especially true for raw onions, which have the strongest blood vessel dilating and hypoglycemic effects. It is best to consult a doctor or dietitian before including onions in the regular diet. Do not eat onions after the age of 60 if you have stage 4 or stage 5 chronic kidney disease or are undergoing dialysis. The kidneys play a critical role in removing excess potassium from the body. In advanced stages of chronic kidney disease, especially stage 4 and stage 5, this function becomes severely impaired. As a result, even moderate amounts of foods high in potassium can lead to a buildup of this mineral in the bloodstream. One such food, which may not seem obvious at first glance, is the onion. 100 grams of raw onion contains approximately 146 milligrams of potassium. For a healthy body, this amount is completely safe. However, when the kidneys are functioning at only 10 to 15% of their normal capacity, as is common in stage 4 and stage 5, the body loses the ability to eliminate excess potassium effectively. This can lead to hyperkalemia, a condition in which the heart's muscle function and the conduction of electrical impulses throughout the body become disrupted. According to a 2023 review by the National Kidney Foundation, in people undergoing dialysis, consuming foods with a moderately high potassium content, including onions, in amounts greater than 100 grams per day, increased the risk of heart rhythm disturbances by 18%. Even a single instance of exceeding the recommended potassium limit in the diet led to adjustments in therapy or the need for an additional dialysis session. It is important to understand that hyperkalemia often develops without any noticeable symptoms and can appear suddenly, with sensations of heaviness in the chest, muscle weakness, and irregular pulse. This is why nephrologists in the United States advise patients with severe kidney failure to follow a potassium-controlled diet and to avoid even foods that contain a moderate concentration of this mineral. Onions are not permanently banned. However, their amount must be strictly limited and always discussed with a doctor. This is especially true if you are on dialysis or have significantly reduced glomerular filtration rate. Boiled or stewed onions that have been cooked at temperatures above 85 degrees Celsius, which corresponds to approximately 185 degrees Fahrenheit, may be used occasionally and in very small amounts, but only if your blood potassium level allows it. Do not eat onions after the age of 60 if you have cirrhosis or chronic liver disease. The liver is the body's main filter. It neutralizes toxins, regulates metabolism, and plays a vital role in digestion. However, when aging or chronic conditions such as fatty liver disease, hepatitis, or cirrhosis impair the liver's ability to function normally, it becomes necessary to reconsider even familiar foods in your diet, including onions. Raw onions contain sulfur compounds and enzymes that stimulate metabolic processes, activate bile production, and increase the workload on liver cells. For a healthy person, this may actually be beneficial. It helps the body process fatty foods. But in cases of cirrhosis or fibrosis, where parts of the liver are replaced by connective tissue and the organ is functioning under strain, such stimulation can become dangerous. According to a 2022 study by the Division of Gastroenterology and Hepatology at Mayo Clinic, patients diagnosed with cirrhosis and active biliary dysfunction who consumed foods with choleritic effects, including onions, experienced symptoms such as heaviness in the upper right abdomen, nausea, and fatigue in 41% of cases. In 18% of those patients, there were signs of increasing ascites and hyperammonemia, conditions related to impaired detoxification function of the liver. In addition, onions can increase bile production even when bile flow is poor, which raises the risk of inflammation in the bile ducts and can worsen overall health. If the liver is already weakened, these reactions may lead to the onset or intensification of symptoms associated with hepatic encephalopathy, such as decreased concentration, drowsiness, and impaired attention. That is why gastroenterologists at institutions such as Cleveland Clinic recommend completely excluding stimulating foods like onions, garlic, and mustard from the diet, especially in raw or fried form. If onions are to be included at all, they should be used only in micro amounts, thoroughly cooked, and only after consulting with a liver specialist. Do not eat onions after the age of 60 if you have gastritis, ulcers, or irritable bowel syndrome. As we age, the lining of the stomach and intestines becomes more sensitive. This is especially important if a person has been diagnosed with gastritis, stomach or duodenal ulcers, or irritable bowel syndrome, conditions in which any irritating food can quickly worsen overall well-being. Onions contain a high concentration of essential oils, sulfur compounds, and organic acids. These substances activate receptors in the mucous membranes, increase the secretion of stomach acid, and stimulate intestinal motility. While this may be helpful for a healthy person, it becomes dangerous when inflammation is already present. According to a 2023 study by the American Gastroenterological Association, elderly patients with chronic gastritis or peptic ulcers who consumed more than 80 grams of raw onions per day experienced worsening symptoms such as heartburn, pain in the upper abdomen, and bloating in 52% of cases. Among those with irritable bowel syndrome, 34% experienced diarrhea, abdominal swelling, and a sensation of pressure in the intestines within 2 hours after eating. Raw or fried onions are considered especially aggressive, as frying at high temperatures above 150 degrees Celsius, which corresponds to 302 degrees Fahrenheit, increases the concentration of irritating compounds and forms substances that promote additional acidity. If you frequently experience heartburn, stomach heaviness, post-meal pain, or irregular bowel movements, it is best to eliminate onions completely during flare-ups. Even after your condition has stabilized, doctors at Mount Sinai Hospital in New York recommend reintroducing onions only after medical consultation, in very small amounts and only in stewed or boiled form. Do not eat onions after the age of 60 if you have chronic pancreatitis or other pancreatic diseases. The pancreas is a very sensitive and vulnerable organ, especially in older adults. It is responsible for producing digestive enzymes and regulating blood sugar levels. However, if the pancreas is inflamed or weakened due to chronic pancreatitis, even a small irritant can cause a serious decline in health. Onions, especially in raw or fried form, contain sulfur compounds and essential oils that stimulate the pancreas to release digestive enzymes. In a healthy person, this helps with food digestion, but in older individuals with chronic pancreatitis, such enzyme release can trigger a dangerous reaction. Instead of breaking down food, the enzymes may begin to act on the pancreas itself, causing inflammation and swelling. According to a 2023 clinical review conducted by the Department of Digestive Diseases at Cedars-Sinai Medical Center, in patients over the age of 60 with chronic pancreatitis, consumption of spicy and stimulating foods, including raw onions, increased the risk of flare-ups by 39%. The most common symptoms included pain in the left upper abdomen, nausea, abdominal bloating, and digestive and bowel irregularities. Fried onions place an especially heavy burden on the pancreas. When fried at temperatures above 150 degrees Celsius, which equals 302 degrees Fahrenheit, onions not only become more irritating, but also harder to digest. This creates a double strain on the pancreas, both chemical and mechanical. If you have ever experienced a pancreatitis episode, doctors from the University of Michigan Health System recommend completely avoiding raw and fried onions. In rare cases, boiled onions that have been thoroughly stewed in soups may be allowed, but only with approval from a gastroenterologist and under close monitoring of your condition. Do not eat onions after the age of 60 if you have gallstone disease. The gallbladder is a small organ located near the liver. It plays an important role by storing bile, which is released when food is consumed and helps digest fats. However, with age, many people develop stones in the gallbladder, ranging from tiny ones like grains of sand to large ones the size of a walnut. When stones are already present in the gallbladder, it is important to be very careful with foods that stimulate its contraction. Onions are one such food. They contain active compounds that increase bile secretion and trigger gallbladder contractions. This can cause the stones to shift. If one of them blocks the bile duct, it can lead to sharp pain in the upper right abdomen that may radiate to the back, shoulder, or shoulder blade. According to the Division of Hepatology at Stanford Healthcare, a 2022 study found that in patients diagnosed with gallstone disease, consuming foods with a strong choleritic effect, including onions, artichokes, horseradish, and dill, increased the frequency of acute attacks by 33%. In some participants, these attacks required emergency hospitalization and surgical intervention. Extra caution should be taken with fried onions, which are often included in soups, meat dishes, and vegetable recipes. Frying intensifies the choleritic effect and makes onions more irritating to the digestive system. If you have been diagnosed with gallstone disease, even in a latent form, it is best to completely eliminate onions from your diet until you have consulted with a gastroenterologist. In some cases, doctors may allow the use of a minimal amount of stewed onion that has been cooked at a temperature above 85 degrees Celsius, which equals 185 degrees Fahrenheit, but only if the stones are small and not causing symptoms. However, in most cases, specialists recommend completely avoiding onions when gallstone disease has been confirmed. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.